So fibromyalgia is a large category. There are so many different symptoms that can be attributed to fibromyalgia. No two diagnoses or two people that are facing fibromyalgia have the same list of symptoms. So what I mean by that is that usually there's some chronic muscle pain, there can be chronic joint pain. It can definitely affect your mood. And a lot of times people have kind of this overall feeling of just not feeling well, which is really unfortunate because any day that we're not feeling well, that we're not feeling our absolute best is a day that is kind of wasted. So fibromyalgia is a large category of a wide variety of symptoms that fall under that diagnosis. There's a lot of medications that are prescribed for fibromyalgia. A lot of them have to do with taking care of muscle aches, muscle pains, maybe even muscle spasms. Many of them, many of the commercially available prescriptions have quite a few side effects, which can cause drowsiness, dry mouth, dry skin. They can make you feel slower. Some people are not able to work with those medications on board, and sometimes you can't even drive a car. So they can definitely affect your everyday life. Fibromyalgia is considered a chronic disease, one that is kind of slowly creeping in. Most people that are diagnosed with fibromyalgia are in their 30s or older. They tend to be more women than men. And it's very interesting. There really doesn't seem to be another significant category. What I see as a pharmacist on a fairly regular basis is that most of the time people who are diagnosed with fibromyalgia, a lot of times are also battling other chronic disease. So perhaps they also have depression. Perhaps they also have situations where maybe they have a low functioning thyroid. Maybe they haven't been diagnosed with Hashimoto thyroiditis or Graves' disease, but they still have a thyroid component. And almost always, these other diseases tend to be autoimmune in nature. So a lot of times we will categorize fibromyalgia as autoimmune, but not always. It really depends on the medical provider that you're seeing.